Right. Welcome everyone to our webinar on managing ill health at work, a brutally honest guide for doctors. You could be tuning in from anywhere in the UK or beyond internationally. This topic is very close to my heart, obviously being a doctor, having suffered from various health related issues, which has on some occasions had an impact on work. My name is Abeyna. I am an occupational health doctor and the founder of Medic Footprints. If you're new to what Medic Footprints is, it's an organisation that supports doctors who are diversifying in their careers and also at the same time looking to better support their well-being. So this webinar is kind of one of several leading up to a very exciting virtual conference we have, which is free, on the Saturday the 13th of October for doctors all across the world. Mental health and technically any health issues for doctors, it's become, I would say, a public health problem in the sense that it's not exclusive to the UK. It's very much prevalent everywhere. So I've had messages and reports and organisations from various different countries. Despite it being a global problem, it's not really managed that well. So in the wake of several high profile reports you may have read recently on the last few years, I thought it was really important to actually run this webinar to give you a really good idea of how you and what you could do to support your health at work, whether you're well now or whether you're ill or whether you've got any colleagues or friends and family that could really do with some support. So without further ado, I wanted to introduce our speakers today. So starting with the lovely Caroline Walker. So Caroline, tell us a little bit about it yourself.
Hi, thank you, Abeyna. I'll just wait for the video to flip over and start showing me. Is it doing that yet before I say hello to everyone?
Which video?
Oh, sorry, am I showing as I'm speaking?
Yeah.
No, perfect. Okay. Hi everyone. Hi, I'm Caroline Walker. I'm the Joyful Doctor. I'm a psychiatrist and psychotherapist by training. But I have an extensive history of having struggled with my own mental health and physical health over the years. I have bipolar disorder, have addiction problems, an eating disorder. I've had PTSD in the past as well. So a real rich experience of my own struggles as a doctor. And that really led me to want to specialise in helping other doctors with their own well-being. So I now specialise in that. And I've got a caseload of maybe 35, 40 doctors now that I see regularly and support through their own challenges. And I do things like this. I speak and do training days and webinars and really just trying to get the message out there that it's okay to struggle and there is support out there if you are struggling as a doctor. So lovely to be here. Thanks for inviting me along, Abeyna, and look forward to telling you a bit more about my story and talking more about this incredible topic as we go through the hour.
Thank you very much, Caroline. And Ali Blatcher.
Hi, everyone. So my name's Ali, and as Caroline mentioned, that she was the Joyful Doctor, I have an alter ego called the Blogging Noggin, which is quite amusing. And I am a former junior doctor. I am a medical anthropologist, currently studying a master's in that topic, and I am also a mental health advocate, which is kind of becoming the most important part of me recently, as I've been blogging about my own experiences with bipolar disorder. So I'm going to be talking today a bit about anxiety and my experience of bipolar disorder and how they've affected me at work and how they can present in doctors today. So I look forward to the webinar and look forward to chatting with everyone here as well.
Brilliant. Well, thank you so much, both of you, for your introduction. Very comprehensive. So just before we start, I really wanted to give you a kind of a why about this. But even before we do the why, I want to hear from you about what you want to get out of this webinar. So what we're going to do is start a poll on why have you joined this webinar. So we've just launched the poll. So the options are: you're wanting to know more about the topic, you're a non-medic but wanting to know more about the topic, you're a doctor with a health problem impacting on your work, or you're off work due to ill health. So I'll give
these will be anonymised, presumably, will they, Abeyna?
Yeah, I won't really know. We won't know the answers, but it would be good to just get a general idea of who's there, and just to make sure that we can tailor the content to who's actually watching. So we have, okay, so people are still voting, so I will give it another 15 seconds. So 70% of you have voted. So those of you are still, I'm just realising there should be a box that's come up. Please do vote, just so we can get a good representative idea of who's here. Can you guys see the vote? No, probably not, hey?
We can, but we can't vote.
Okay, that's absolutely fine. All right then, I think we will close it. There's still some people voting, but I'm going to close it now. So, ending the poll. So half of you have a health problem impacting on your work. A third of you want to know more about the topic. 22% of you are off due to ill health, and 6% of you are non-medic wanting to know more about the topic. So thank you very much. That's really useful. So just to move on as to why we're doing this webinar. So I did mention briefly earlier as to one of the reasons why we're doing it. So you may recognise or you may not recognise some of these doctors. So my real kind of motivation, especially with Medic Footprints as an organisation and really promoting wellbeing for doctors as part of that whole career change journey, is that there have been a lot of high profile and low profile cases of doctors who have sadly taken their own life, and for various reasons, not always work related. But doctors do tend to be somewhat of a different group, which we'll go into later, whereby they're the highest risk professional group for suicides and mental health concerns. So in particular, I mean, these two doctors sadly took their own lives. I mean, recently in the BBC and Victoria Derbyshire show that's going around social media recently, Sophie Spooner, very sadly, a very talented doctor, took her own life last year on a background of mental health issues. And the gentleman, Dr. Epen, he unfortunately took some drugs. He was an anaesthetist, and took some drugs and unfortunately ended his own life. So he unfortunately had the means. Very recently, we have a gentleman called Edward Zigak in Birmingham, who was found at work sadly. He hadn't actually gone home for the weekend and was found at work. So that's actually an investigation that's ongoing. And then we've got Rose Polge, who unfortunately passed away during the junior doctor contract debacle. And we actually have an award which is named after her at the moment. And one of the most high profile cases, which actually happened, I think it was the late 90s, remember, sorry, correct me if I'm wrong, yeah. is Dr. Daksha Emerson, who suffered from, I think it's bipolar disease, Caroline?
Yes, that's right. Yeah, bipolar disorder.
Yeah, so I think she was a psychiatrist as well.
She was a psychiatrist in the east of England.
Yes, and she actually, obviously had quite a few issues. She thought she had a lot of help as she was under the care of various services. However, they weren't adequately coordinated, and very tragically in the end, she took her own life and that of a child. I mean, obviously this is a very tragic but quite drastic and extreme circumstance. But this, as a result of this, there was an inquiry as to how best to support doctors. And yes, there are some bespoke services available to doctors, but however, strangely enough, they're not very well known. Obviously, funding is limited, so they're not as accessible as potentially they could be, and it's not a very well known issue. So when doctors do seek help, it's really important that healthcare professionals have a good idea as to actually if these doctors are actually seeking help, they do need a special kind of help. So we'll go into that later on. So if you before we go on, if you do have any specific questions that you have for any of the panelists, please address those questions in the Q&A box, not the chat box. The chat box is great for general chat, but if you've got any specific questions for the panelists, please put that in the Q&A box. I will try to do my best to monitor everything, but if you do any questions, please do address it in the Q&A box. Yeah. Okay, someone asked a question. The questions asked in the Q&A box visible to... No, they're not. They're not visible to anyone else apart from myself. And the panelists, can you see the Q&As?
No.
Yeah, so it's just me that sees it. And I think you can also submit a question anonymously too. So it's completely up to you how you approach that. I
think you can submit a question to each of us as individual panelists if you wanted to.
Through the Q&A box or through chat?
Through both, I think.
Yeah, so Alana Proctor, if you've got a question, again, either the Q&A box, please, or chat if it's something you want to address to everyone that's with us today. Okay, brilliant. So this is a general overview of what we'll be covering, and I'm going to pass it on to Caroline, I'm going to go back. So Caroline's going to cover depression and addictions in doctors. And the format of this presentation is meant to be relatively down to earth and more of a conversation, a structured conversation, according to these specific areas. So Caroline,
Thanks, Abeyna. Thank you, and welcome everybody. Yeah, please do ask us questions because we want to make this as helpful to you as possible. Yeah, I was going to talk a little bit about mental health problems amongst doctors. I think there's a growing awareness that mental health problems are incredibly common amongst all human beings, but there's also a growing awareness that they are even more common amongst doctors. So take something like depression, for example. You're probably looking at something like 1 in 5 people struggling with depression in the UK at the moment. And some of the evidence we have suggests that rates amongst doctors may be much higher than that. So some studies, and particular doctor populations, rate the rates as high as 70 or 80%. So this is a phenomenally common condition. And Abeyna had asked me to talk a little bit today about how depression can present sometimes slightly differently amongst doctors. So yeah, what I see most often is doctors not necessarily coming and saying, hey, I've got low mood, or I think I've got depression, but just having a general sense of being overwhelmed or overworked, or like there's just not enough time, or they're just not keeping on top of things, or they're maybe just not feeling as motivated or enjoying things as much as they usually do. I think often doctors are incredibly good at keeping a mask on and showing a mask to the world that is, happy and joyful, when actually inside they can be really, really struggling to get out of bed in the morning, to get through the day. I know I was when I struggled with my many episodes of depression. Nobody would really know apart from me. Maybe those closest to me might have an inkling that something was going on, but actually, yeah, it can be sort of simple tell signs, like maybe you're just staying a bit later at work, maybe you're finding yourself reaching for an extra glass of wine in the evening, maybe you're just not seeing your friends as much as usual. Usually work is the last thing to go for doctors who are depressed. Usually their friendships are the first thing to suffer, then their closer relationships. So they might come to me saying actually they're just struggling with arguments with their partner or something like that, and actually underneath it all they're struggling with depression. Like most mental health problems, actually it's quite common for doctors to turn up thinking they've got one thing and actually they've got another. So I'll often see a doctor come in who'll say, oh, I think I might have OCD, and actually they've got depression. Or I think I've got health anxiety and actually they've got OCD. Or I think I've got an eating disorder and actually they've got PTSD. And so it's really important, I think, to not self-diagnose ourselves. It's really important as early as you can, as early as you think something's just not quite right, to kind of seek help. Abeyna, did you want to ask any questions about the sort of depression side of things before I move on to addictions?
Yeah, so, and feel free if anyone has any questions about that. So we talk a bit more about how, from your experience, how do doctors present atypically when it comes to depression? I mean, you've touched upon that already, but what kind of things have you seen in your professional experience?
So something I'm seeing really commonly is, let's say, a typical symptom like poor concentration that might be affected in anybody with a depression. In a doctor, it's often like it's okay at work, but it's when they get home that they're really, really struggling. It's like we somehow have this certain amount of energy that we can just about hold it together, and we prioritize, you know, keeping it together and doing well at work. But actually, the moment we leave work, we're just a bit of a gibbering wreck. Get home, veg out in front of, you know, the box sets and just really struggle to even like read through a magazine article or focus on telly, you know, like we normally can. So I see that quite commonly, that kind of real strong contrast between, you know, where we can kind of hold it together and seem to be okay and be making incredibly complex and difficult decisions at work, but then really struggling with basic stuff when we get home. That's just one example. I think one of the other common themes I see is when depression is getting quite bad for doctors, it's very, very common, obviously, for them to have thoughts of self-harm and suicide. And some of the most common ones I see are, or I hear about, are wanting to drive the car off the road on the way to or on the way back from work. And I experienced that. And I think, again, it probably speaks to that idea that we are so busy and so focused on keeping going at work, but then when we actually finally get out, we kind of take the bleep off, take the stethoscope off, get into the car, we're driving along, actually we're on our own with our own thoughts, and actually that's when it can really hit us just how bad things have got. Other common sort of difficult thoughts I hear quite often from doctors are around somehow wanting to almost like separate their head from the body, because like what's going on in their head is just too much. So like often doctors will talk about wanting to shoot themselves in the head or to hang themselves by the neck. And that's really, really common. And I just want to say, like, these thoughts do not mean that if you're having these thoughts, it's okay. Doesn't mean you're going to act on them. They can be quite scary, but just tell somebody. And there is help out there, because they're just a symptom that things aren't quite right at the moment, you know, and that there is help that you can get to start to feel better really soon. Like within a matter of weeks, you could be feeling better.
So yeah, why don't you give me a kind of overview of what kind of support systems tend to be quite effective for doctors with depression?
Yeah, so at the moment, the doctor-specific support services are still a little bit geographically different. So there's a lot of people working towards getting a free NHS service for all doctors, self-referral, confidential across the whole of the UK. But at the moment, things are a little bit patchy. So as it stands, there's a fantastic service called the Practitioner Health Programme, which is open to all doctors with mental health problems and addiction issues. Self-referral if you live in London or in Kent, Surrey, Sussex as a trainee. If you are living outside London, you can get treated by that service, but you just need to go through your GP, get a referral letter. At the moment, there's another fantastic service, their sister service, GP Health, for all GPs and GP trainees. Similarly, you can just self-refer. If you Google either PHP, Practitioner Health Programme, or GP Health Programme, they'll either be able to see you and help you within a week, or they'll be able to signpost you onto somebody who can. So I think those are the two main ones I'd suggest, but I do have a list of dozens of free support resources on my website at joyfuldoctor.com. So
brilliant. Thank you, Caroline. So we do have one question.
Yeah, fire away.
Questions. So one is actually obviously quite specific from an anonymous attendee, but we can try and answer it generally, but obviously every case is different, so it's always best that you get specific help for you. So I've had depression since 2012 and went through medical school with it. how can I get through the foundation program? I'm off sick after taking an overdose and being admitted to hospital for 2 days, feeling quite directionless and not knowing whether to go back to work or not. I've been in contact with my supervisors, OH, HR, etc. Also in therapy, seeing GP and psychiatrist. I just don't know whether to go back. So
yeah, I mean, that's an absolutely classic case. Can I just say well done for sharing and asking that question. You are not alone. There are many, many doctors out there struggling and you know, taking overdoses, ending up in hospital, that get better and get back to work, whether that's in medicine or doing something else. So yeah, well done for sharing, and it is going to get better. I think depending on where you live, I think, yeah, the practitioner health program or the GP health program, you said you're going to foundation year. Would you be able to share with Abeyna whereabouts in the country you are?
I'll have to come through, but
yeah. So I would definitely recommend the practitioner health program, because they can often work alongside your GP and your psychiatrist, and just come at it from the point of view of the fact that you're a doctor. Because I think, you know, although doctors struggle with mental health problems in exactly the same way as every other human being, there are unique issues that surround the work that we do, that it could be really helpful just to talk through with someone that gets that. So yeah, I'd really recommend that they look up that service. And I'll be saying this at the end as well, but if anybody wants any help or direction in accessing those services, they can always message me and I can help them do that.
Yeah, so my brain, my health brain kind of gives a slightly different answer referring to the work scenario. Sure. I would say don't worry about work. Like, the most important priority for you is getting better and getting to a point where you are happy going back into a work scenario. If you don't feel like all of your, you know, your healthcare providers don't feel that you can go back to working as a doctor right now, but could be doing other things in the meantime, I would definitely go and see if you can try and engage in other types of work. But it doesn't mean that you can't go back to your full-time post, because obviously it sounds like at this time you are needing help, you're in therapy, and I think that is definitely the most important priority for you. There's nothing to say you won't get back to working as a foundation doctor, but it's really important that you give yourself that space and time. It sounds like you've got the right people behind you, so yeah.
Yeah, I completely agree with that, Abeyna. I think you're absolutely right. I think it's very common when doctors go off sick for us to get really worried about the work piece of the picture, and to be so desperate to get back to work and to be able to not see how to get there. And I had that certainly when I went off the first few times from work. I kind of felt like, God, I can never be a doctor again. You know, how can I possibly go back? And it was just so scary and so overwhelming. And Abeyna's absolutely right that the priority is to focus on getting well, and then actually your options kind of open up from there, and the options are limitless, like whether it's going back to medicine or not. You know, there's so many options available. So
yeah, and you'll find that at the time when you're well, you'll be able to think clearly and make the right decisions for you, regardless of what those decisions are. It could be going back to work, it could be staying off work and doing something else, it could be a hybrid. It's so limitless. So don't worry, get better, basically, in short. So there's a few other questions coming through. Is there a page out there? Actually, do you mind if we actually go into addictions? Because I really wanted to cover that, and we'll try and address more questions later on. Is that okay, Caroline?
Sure, absolutely, no problem. Yeah. So again, addictions, incredibly common in the general population. I think probably something in the region of about 1 in 5 people have an unhealthy relationship to alcohol alone. But addictions covers more than just alcohol, and I think that's a common misconception. You know, you can essentially be addicted to any substance or any behavior that might be healthy in some ways, but actually you're using it in an unhealthy way. So amongst doctors, we do see really commonly doctors that are struggling with alcohol, with drugs, with gambling, with social media and internet addiction, all sorts of different sex and love addiction. That's incredibly common and incredibly shameful for doctors, and very hard for them to come forward about. But the take-home message, I suppose, is that all of these addictions are very, very common. Doctors are not immune. In fact, our rates of certainly using drugs and alcohol are harmfully are higher than the general population. But again, the good news is that when you get help, when we get help as doctors, we do really, really well. Statistics coming through from treatment programs around the world are showing kind of recovery rates of up around 80-85% at 5 years, and that's maintained, and that's unheard of in this area of mental health. So doctors do get very sick. They are just as vulnerable to developing addiction problems, but if you can get help, if you can just reach out and just tell somebody, then the help and support is out there.
Thank you very much. So I guess another question is, what does an addiction look like? I know it's a very broad question.
Yeah.
How does someone know that they're addicted?
It's a really good question, actually. And I think addiction is something that's defined differently by different groups. And I think our medical model of working with addiction is actually a little limited sometimes. So there's many ways I could answer that question. I think a lot of it comes down to how you define it actually as an individual. And I think it doesn't really matter what word you use. So I'll often come across doctors who are struggling with their relationship to alcohol, who absolutely do not want to use the word alcoholic. And that is fine. Like, it really doesn't matter what term you use, as long as you are starting to have a growing acceptance that you've got a problematic relationship with that particular substance, and you're engaging with the help to try to develop a healthier relationship. So in a way, I'm going to skirt your question and not answer what an addiction is. I could give you the medical definition in terms of the ICD-10 and the DSM-5, but I actually think it's more helpful for doctors just to think of it more generally. You know, is your relationship to whatever the substance or behaviour is it bothering you? Is it troubling you? You know, do you want some help with it? Then yeah, come forward, and there is help there.
Mm-hmm. So the best way to come forward is that to speak to, I guess it's any of those services that you've mentioned.
Yeah, so there's a whole range of services. I think it's important that as doctors we remember for all mental and physical health problems that we have access to the same support services that anybody else does. So you can see your GP, you can self-refer to IAPT for psychological therapy, for CBT. But yeah, there are these doctor-specific services that I'd highly recommend getting in touch with. And there's a whole other list of services I can, we'll give you the address link to look at the end of the webinar. I would say go for the one you feel most comfortable being open and honest with, because the important thing is that you're talking to somebody and that you're able to share it and to feel like understood and not judged. And yeah, so I think, Abeyna, you're going to go on to talk about this on your slides, but look for the support that is supportive rather than,
Yeah. So we've got quite a few questions coming in. I am going to cherry pick a few that we can probably address quite quickly.
Sure.
And then at the end of the session, don't worry, we will do our best to go through all of the questions, time permitting. So we are aiming to finish at 8, but if needs be, we will address all of the questions. So it might go on to kind of 8:30. So don't worry, we will try and get through everything. So just going back to PHP, so there's a question saying how easy is it to be referred to PHP? I was working in Oxford and local GP didn't know anything about it. Local OH didn't have a clue. I mean, I know obviously because I do some advisory work as an occupational health physician for the practitioner health programme. It's accessible in London, but for GPs, it's only a national service for GPs at the moment, isn't that correct?
No, actually any doctor outside of London can access the PHP, but they can't do it by self-referral. They need to have a GP referral letter. Yeah, so it does take out that slight element of confidentiality. You know, you need your GP to know what's going on, but it's quite a simple process. So what I would suggest is ringing up or emailing PHP and saying who you are and where you're from, and they will guide you through it. And essentially they just need a very simple letter from your GP to say what's, you know, please can you see this doctor who's struggling, and then they'll arrange for, guide you through how to get the funding arranged from your local CCG, and you can access, you know, the same services that the doctors in London are getting and the GPs are getting across the UK. As I say, there's a lot of people working to make this a truly self-referral service across the whole UK for all doctors at the moment. Hopefully that's coming soon in the next couple of years. Watch this space.
Brilliant. And yes, there is a recording available. We're recording it right now. So we'll make this available. Actually, it's live streamed on Facebook as we speak, but there will also be...
Hi, Facebook.
Hi, Facebook. I'm not actually looking at Facebook right now because I was going to focus on this, but if you've got any questions, I'm sorry, it might not be addressed. but yeah, we'll also let people know, and it will be available through Medic Footprints too. And there's another question with regards to, let me just go back to that one. Is there a page out there listing services available to people in different areas? Things I hear about, I'm not sure if they're only available to English doctors, are any limited?
So there's certainly a page on my website, www.joyfuldoctor.com, help for doctors. And that lists dozens of support resources that are available to people across the UK, to doctors across and medical students across the UK. Some of them are local, but it'll be written on there. All the links are on there, and there's a brief description of each service, so you can kind of have a scan down and see what's available in your area. A lot of them are national, and across borders.
I mean, every service does have different services. So every area has different services available, but very few of them are actually bespoke locally. I mean, it depends on what kind of doctor you are and where you're based, and depends on what kind of services you feel that you need or you're most comfortable accessing. As we mentioned, there's a lot of local services that starts with your GP usually. But if you're after something more specific, there are quite a few national ones like BMA Doctors for Doctors, which is available to non-BMA as well as BMA members as an example. But with Medic Footprints, there's also a list on our website too. But what we're also planning to do is build a platform that connects doctors directly with bespoke wellbeing services everywhere. And our objective is really to collate all of the bespoke doctor wellbeing services and just make that available and make doctors aware of that, whether it's local or national.
And I think these services are growing all the time, right, Abeyna? There's more and more coming out of the woodwork, and it's fun. It's a really exciting time, actually. I think the future for doctors' health is looking bright, much brighter than it was 5 or 10 years ago.
I think mainly because we're talking about it more now and openly, and the more that we do that, the more that we spread the word and raise awareness, the less taboo there will be, and the more available these services will be, because people will be talking about it. As you know, most things actually do go through word of mouth. So so anyway, I know there's some more questions, but let's move on to Ali, who's got a wonderful really interesting story to tell about her own personal experiences, and also we'll be talking about bipolar and anxiety. Hi.
Sorry, I've been a bit silent on the back seat there, but is everything all right with the video and everything?
Yes.
Yeah, you're looking great.
Some flower in the background.
So I'm going to talk a bit about my journey with mental illness throughout medical school and also whilst practicing as a doctor, and go into my a little bit about what I'm doing now as well, just to kind of give people hope that there is life after medicine as well for those who choose to do so. So firstly, I went to University of Nottingham, same as Abeyna, and we obviously studied 5 years, and it was and I had anxiety through medical school. I developed it whilst I was there, and I knew what it was. I'd studied it at this point and understood what it was, but I didn't disclose it to anyone. I kind of kept it in, maybe close friends. It kind of came out in bursts. Like I would have to walk out of lectures, and I had a very avoidance attitude with it, which is very common. And the way it presented in me personally was in lectures. So I would walk out of lectures and seminars, and the way that it was viewed in the medical school itself was because I hadn't disclosed it, and no one knew what was going on, then it was taken that I had quite a bad attitude towards the course. And I think I remember receiving some really negative feedback at one point that really kind of shook me, and I was like, how do you not know what is going on here? But people don't unless you tell them. So so I finally disclosed in 4th year, and I told this was at a point where like I was sort of really dreading walking into the hospital every day, I told the clinical sub-dean, who sorted a few things out for me and switched my placements around, so that I could stay in the area to attend university counselling. And they had quite a good response to it. And then later on, they transferred all my anxiety, as in the diagnosis of anxiety, they transferred it onto the foundation school. So I went to Wessex Foundation School in Dorchester, F1 and F2. So during F1, I've always had these thoughts about leaving medicine, and I was always like, oh, do I, don't I, throughout medical school even. But I was in F1, I was thinking a lot about expedition medicine, which is kind of on the other end of the spectrum, really. But it's something I was interested in because I thought it would get me away out of the hospital, out of like lectures and out of treating individual patients, and maybe just outside as well. Working outside was something that just really I wanted. So I went on a couple of expedition medicine courses, and I found myself in F2 going on a television show, which was for Channel 4, and I was the doctor out of 23 people who were put somewhere in the wilderness. And I was treating people there, and had like severe highs and lows whilst I was there, real ups and downs, purely because it's quite rational for the experience, but also because it was the beginning of my bipolar diagnosis. So that came about when I left. I ended up leaving the show, and I was admitted pretty much straight into hospital with a psychotic episode. And that didn't relate to work. I wasn't working at the time, but it was a very unique stress I was under. Hopefully I wouldn't wish it upon anyone to go on a reality TV show and do that kind of thing. But so then I recovered from my hospital admission and took 4 months off work, went back to F2 to complete my F2, and meanwhile I was clinically depressed. And then after F2 I completed training, was locuming for a little bit afterwards, and I had exactly what you're talking about, Caroline, driving to work. I had a complete breakdown. It wasn't a breakdown, actually. It was kind of I was having a lot of epiphanies, and it was actually signs of mania. I was having thoughts about why I went into medicine in the first place. I was having about the NHS, about how I was going to save. My consultant found me crying in the car, and he was like, take the morning off, but come in the afternoon. And then I was on the wards, basically scribbling notes about how I was going to be saving the NHS, how I was going to be like, I had all the answers. Everything was like going on in my head in a good way, but in a damaging way. So I did have the insight, luckily, to realise this was kind of wrong. So I rang my consultant and said, can you have a look at this? And I showed him my notes. I was like, is this right? And he was like, what the hell is this? Like, you could see it as quite a comical situation. You know, it's quite bizarre.
Why did you show it to your consultant, in particular?
It wasn't the consultant, actually. It was the foundation program officer, who I had developed quite a lot of trust with. Okay. He was the one that let me go on this crazy experiment. So and I was back locuming in Dorchester. So I've got a picture of him here, actually. Here he is. Me and him. This was a few days before I went manic. Anyway, if anyone's in Dorchester, then he's got right. But he sent me to the GP, and then I ended up in hospital again. And this time I would say it was pretty much work-related stress that had caused the mania, that caused these symptoms. and I ended up having a longer stay in hospital this time. Then I did go back to work after this, one last time.
Ali, what was it like actually being an inpatient and obviously being a doctor at the same time? How was that process for you?
It was really weird because I was in the hospital that I was supposed to have done my psychiatry placement in. So I didn't do that because I went on this adventure instead and did expedition stuff. But I was being treated by a colleague who was one of the F1s 1 year below me. So she was actually my doctor, but it was quite comforting in a way. And I think, I know this is bad, but they probably did treat me with more respect than some of the other patients. That's just a kind of disclosure, I guess. But obviously it was a really scary time for me, but I found that I was able to get better really quickly, and like Caroline says, there is a good prognosis for doctors who are mentally ill. I would say that I got better within like 3 or 4 days, and I was put on psychotics and mood stabilizers, and they just had a really dramatic effect. And I engaged with the therapies there. I engaged with the medication. I complied. You know the system, so you are at an advantage. You know the psychiatry. You know that psychiatrists have good, your best interests at heart, and you know that doctors are good people, whereas some people don't think that. So yeah. It was.
Sometimes you do find that medics are, they're against being medicalized and would prefer not to take medication. Motivation in the sense of getting better, like where did you want to go? I mean, because it was the last one was after your foundation training. What were your thoughts about getting back into work, considering, the episode?
Yeah, so I was not very keen to go back to work anyway, because I was like, but it was kind of complemented because I'm now doing a master's part-time, so I was going to do part-time locuming. But I didn't really, I thought, basically I didn't think I could do anything else. And I think that's a lot of what a lot of doctors think, is that they feel trapped in their profession, and they feel like it's not the only that it's the only thing that they're good for, which is just ridiculous, because there are so many transferable skills from medicine into other occupations. And I don't want to be sitting here, whatever, saying to everyone quit and give up. But not that it's given up at all either. But I just think that, as you said before, other options are available other than medicine. And I think that if you are unwell, then maybe it is best to do something like volunteering. Obviously you need to make money, but volunteering or working for a charity or something that's a giving, caring profession that you get something out of, before going straight back into medicine.
Mm-hmm. Yeah, I think that's a really important point to make that I will probably speak a little bit more about later on. That actually there are plenty of things that you can do before you step into medicine. Just remember, medicine is a very intense, high pressured, high responsibility role. And there's not much give in the health system for someone who's not 100%, just because of the risks associated with making mistakes, as we all know. But there are lots of other roles in the world that you can do temporarily before you go back into medicine. So obviously keep that in mind if you are rehabilitating or getting better. Or alternatively, there may be some roles in your workplace that you can do that's not your usual clinical work. Think about the non-clinical stuff that you do in your work, like audits, research, teaching. There might be some managerial stuff. There's loads of things, and it's really about how supportive your employer is in, with regards to getting back to work. So thanks very much, Ali, really for sharing that story, which is very candid and wonderful to hear, just to kind of reach out and inspire others that actually there is a light at the end of the tunnel, even when it's very difficult, and how you kind of handled that. So just going back, I was going to do a bit on stress, but in the meantime, why don't we go to another question? So I'm currently on the run through O&G training program. I've been off sick for about 10 weeks. ARCP is tomorrow. I don't know, for those of you that don't know ARCP, that's a training review, annual training review. And I don't know how long I will need off sick. So should I ask for time out for career break? So I think you're talking about career break for health reasons, or should I take it as sick if I'm not 100% ready to go back to work? So my answer to that question is that you should not be going to your ARCP if you're off sick. It's not really a decision. You know, if you're signed off sick, do not go to your ARCP.
Amen to that. Just want to completely back that up. Yeah, just don't go.
You shouldn't really be making any decisions until you're well. There will be processes that your organisation has, and HE will have, if you're too unwell to go to your ARCP. And there's no real easy answer, and you need to get the right kind of support and advice, and the people around that to help you with that is your GP, your OH provider. I mean, they might even send you to occupational health just to get their advice as well. But I would say don't go to ARCP if you're sick or you're not ready to go back to work. And that also includes having kind of work-related conversations. So yeah. So I was just going to quickly go through some stress-related stuff. So what is stress and what does that look like? So we can go through the whole medical, biological definition. But technically speaking, it's how we respond as humans to a physical, mental, or emotional factor. So that could be a whole range of different things, and it's how our body responds to that. And some people, particularly doctors, I think, and even I'm talking about myself, we don't really recognize when we're stressed, because we talked earlier about the mask that we have as individuals, and how that manages to cover up a lot of the internalization of our health. So I just wanted to quickly go through a case study. This is not a person in particular, but it's an illustration of what I see quite regularly. So we've got a 43-year-old general GP partner who does quite a lot. She's exceptionally busy at work. Work is understaffed. She's working up to 80 hours a week and not really having much in the way of breaks, finding it very difficult to sleep, and has some abdominal pains and symptoms and headaches and migraines. So she sees her doctor, she has some investigations, they've ruled out most of the kind of scary stuff, find some nutritional deficiencies, her symptoms are prevailing. So I'd love it if people who are with us could answer the questions. So what are the main factors at play in this case, and what could she do to address them? So yeah, so if anyone could answer the question, I mean, what are your thoughts, Ali? What are the main factors at play in this case?
Well, obviously she has got a lot on, as well as her work. Then she's volunteering and taking on a lot, and this is something I can relate with. I definitely take on too much when I'm sort of in the high stages bipolar, and then I will take all of it on, and then when it actually comes to doing the volunteering or doing the teaching roles, or then I will not be able to, because I'm at a low stage in my life, and that's kind of quite typical of bipolar, having that striving personality, and typical of doctors having that striving personality. Mm-hmm. So that's one of the factors.
Yeah, so there's the personal factors that obviously she's taken a lot of stuff, and she's probably not going to stop that anytime soon because of the level of responsibility, particularly as she has as a GP partner. Anything else, Caroline? Sorry, you're on mute, Caroline.
Sorry. Rhiannon's just come in as well on the chat to say sounds like she's focused really on the physical symptoms and maybe not revealing everything to the GP. And I think my psychiatry brain has certainly pricked up my warning, my antennae are going, oh, something might be going on here on a more emotional level. So as she got an undiagnosed, mental health problem like depression or anxiety, but it also, for me, it highlights what a lot of doctors are struggling with, which is that we're working in an absolutely ridiculously overburdened system at the moment. And as doctors, we're very capable, driven, motivated. We're wonderful human beings, not to blow my own trumpet and your trumpet too much, but we really give and we give and we give. And if we're asked to see 40 patients, we see 40 patients. If we're asked to see 45, we see 45, and we just keep going. And we have to, I think, take a step back and think, actually, where do we put our boundaries in? Where do we say, actually, enough is enough? This is too much, and I have this conversation day in, day out with doctors who think they can't say no to things. And actually think it's really important for this lady to have some time and space to sit and talk through with someone and think about, really the cost and the damage that this is doing, and whether she maybe needs to pull things back a little bit, even take some time off maybe. But yeah, just realizing and recognizing that this isn't that she's not capable. This is too much work for anybody. Yeah.
So, I mean, this amount of work it's not uncommon for someone to do this amount of work, but it is an abnormally large amount of work. That makes a lot of sense.
Yeah.
I mean, medics aren't the only profession that tends to overwork. Actually, you can see it across all sectors.
Yes.
But unfortunately, we are in a certain culture, particularly if you live in kind of big cities, that you're essentially a non-stop timer when it comes to what you can do until you crash. So, yeah, I mean, everything that's been mentioned so far, there's no right or wrong answers to this, by the way. There is no correct answer. But yes, there are several factors regarding to the mental and the psychological aspects. What could you do to address this? So we mentioned taking a break. So there's career break, there's taking some time off, there's reducing her commitments or renegotiating that with her partnership. There's obviously correcting the nutritional deficiencies. I mean, she might be a good candidate for lifestyle medicine to really have more insight as to, what stress looks like for her, how she can maintain herself, but also make the right choices for her lifestyle moving forward to make sure she protects her general health and well-being. So, I mean, this probably describes a lot of most doctors in the healthcare system, including myself. And, we've all been through burnout. I mean, a lot of us have been through burnout, and it's really unpleasant when you get there. And actually, there's no real cure for burnout apart from essentially learning how to manage it. And I'm speaking from a personal perspective, having been through it a few years ago. I'm much better now, but I do have a very, very minimal reserve whereby if I do too much, I'll crash and I'll feel ultra exhausted. I won't be able to go anywhere. And it will take me another week to actually get back to my baseline. And that's just after one day of pushing myself too much. So those days aren't that frequent, and that's because I learn how to manage myself. Sorry?
We've got a comment from Yara on the chat.
Yeah.
Talking about how they have to accept all sorts of things at work because they're on a temporary contract and always feel threatened that they'll be kicked out, which I think is a big worry for a lot of doctors, is about the GMC and regulations, and we're going to talk a bit more about that later.
Yeah, we'll talk a bit more about that now. And I completely understand with how you feel, because regardless of whether you're international or you're full-time or UK based or originated, whichever, regardless, there's always a feeling of guilt if you have a health problem, whether it's short-term, long-term. And there's always this concern of a threat of actually not doing well and not being able to maintain your job, and the pressures on you from management. probably be kicked for realistically saying this. The healthcare system is stretched. So unless you do something drastically wrong, the risk of you losing your job based on saying no to being overworked is generally extremely low. And if you do, then obviously there's a chance that you can take, if you think you've been unfairly treated by your employer, have a chat with a medical legal advisory or a union, and there's always the option to take to an employment tribunal. But I guess it's like you need to make the right decisions for you as to whether you want to continue working in that environment. Again, I know it's not easy, especially if you've come from another country and this is your first job and you're trying to at least build up your portfolio. At the end of the day, you've only got one life, you've only got your health to go for, and it's so important that you look after that first. That's all I can say. Go on, Caroline. Mute.
Sorry, I've been taking the mute off so I could answer some of the questions by typing as well. So sorry about that. I keep forgetting to unmute myself. I just wanted to add that there's a lot of fear amongst doctors about the consequences on their career, if they make a mistake or if they get ill or if something goes wrong. And actually the statistics are really encouraging. The number of doctors that are, referred through to the GMC from health programs like the practitioner health program are very, very small. I think out of sort of 5,000 plus doctors they've seen, they've only had to inform the GMC without the doctor's consent on about 5 occasions, something like that. So
how many are actually struck off due to health problems from the GMC? Any stats?
Very, very, very few. Very few. The vast majority of doctors with health problems are recognised as such now and supported to get the help they need and to return to work and to work as doctors if at all possible. And there's a growing movement towards doctors actually coming through to mental health services first before going through to regulatory bodies like the GMC, because there's a growing recognition that actually a lot of the times that mistakes are being made or complaints are made, that actually underneath that is a doctor that's been really struggling for some time without the proper support and treatment that they need. So I would say please don't ever not come forward because you're fearful for what's going to happen to your career. I have bipolar disorder, I have multiple addictions, I have had PTSD, I have an eating disorder, I've had many physical health problems, and it's never stopped me. I got the job of my dreams through, in training, and I'm now doing a job I absolutely adore and love. So the support is there, the help is there. If you just come forward and ask for it, then, the fear, we can all understand the fear, because you see all these crazy stories in the press about doctors being struck off, but those cases are so few and far between. And what you don't see is the thousands, literally thousands, I think 5,000 doctors treated by the practitioner health program over the last few years, of doctors who are, doing well and are absolutely fine and don't go anywhere near the GMC. So
yeah, and also give yourself the time to get better, and that is so important. It's very, and we touched upon that earlier, but I just want to re-emphasize, if you give yourself the time to get better, you will get back to work and you will be fine. But if you rush things, which is very, very common amongst doctors,
yes,
tempting to do because you feel guilty, there's a risk that things slide downhill quicker than you would like. So just give yourself that time and that space. Don't make any decisions until you're better. Just to quickly go through the rest of the slides, and then we can go to Q&As. I know that's basically will be really useful for everyone. So, just to mention, obviously, stress can be really good for your health, as long as, everyone gets stressed at work, and that can be very great in the sense that it's quite motivating. But bad stress is obviously stress that's consistent. It has a negative impact on how you feel on a day-to-day basis, and then it starts to spit into your personal life or other area of professional life, and then it starts to impact on physical or mental health problems. And you should go and get help just before you get there, or if you notice any signs that's related to that. It can lead to mistakes as well at work. If you feel that something that's happening in the course of your work is quite unusual for you, or you're noticing any mood swings or anything that's unusual, then go and get some help as soon as possible. With regards to stress, stress is not really recognised as a medical problem per se. It's, as I said, it's a natural reaction to things in the environment. That's why from a work perspective, we generally say if this is a work-related stress, then your employer has a responsibility to manage that in some capacity, or at least attempt to manage that. Because whilst you're at work, your employer is legally responsible for you under the Health and Safety at Work Act 1974, just that you're aware of that, and that's under the Health and Safety Executive Management Standards. So we see stress all the time in doctors and other workers. The most important thing to remember is that there are lots of ways to mitigate stress, and there are lots of causes for stress. So the most common thing we see is workload. So there's just too much work. Every person is different according to how much they can actually manage. So don't try and compare yourself with other people. Everyone's in a different scenario. It might be the same job, but everyone has a different capacity. Obviously, there's a level as to what is generally expected in that role. But if you get to a point where you're overworked because of fewer resources, fewer staff members, expected to work later, you've done like a 14-day stint, then that's obviously way over beyond than what you would normally be expected to do. So the obvious adjustment there would be to reduce your hours, to make sure that you're getting breaks throughout the day, and to really look at the rota. Other solutions to if you've got to a certain point, which we see people have actually reached crisis point and they physically can't work anymore, or they're fine, but they go home, they're crying, they're drinking, really destructive behaviours, then it's really important that you step away from main stressor if work is the only one, and take some time off really to get better and get the support that you need. If the workplace isn't going to change anytime soon and adjustments cannot be made to improve your workload or the work environment, other options include changing your job role if your employer is happy to do that. So a lot of doctors, that's one of the reasons why they decide to change careers, because they don't like the kind of level of workplace demands, they want to change to something else. They can do that within an employer. They can actually change their career entirely and leave medicine. But I just like to remind people, medicine is so broad, and I personally think, and this is slightly controversial, that it's very difficult to leave medicine because you'll always be using your transferable skills in some capacity, whether you're called a doctor or not. And within the scope of practical medicine, even that is so diverse, and that's what we do in Medic Footprints. Just very, very briefly, we sort of see a lot of musculoskeletal stuff. If that's you, there's lots of support that you can actually get for that, other than going to occupational health. Access to work is one thing that people just don't seem to know about, and it's probably the government's biggest secret, but actually widely available. So Access to Work is a government funded organisation that supports individuals who feel that they have a disability to help them continue working. Very simple as that. What does having a disability mean? So Equality Act, so this is a UK law. The definition is based on if you have a physical or mental health problem that is substantial, so affects your ability to perform day-to-day duties, or not duties, but day-to-day activities. It's normal. Is long-term, so lasts more than 12 months, or likely to last more than 12 months, and has substantial impact on your activities. So it's a bit of a wordy definition, but in general, it really depends on the opinion of an individual, your manager, or your occupational health advisor or doctor, as to how you'll be treated. So under law, if you are seen to be disabled under the Equality Act, your employer has to consider what they call reasonable adjustments. So if you're someone with a mental health problem that's seen to be disability, and it might be that you need more time off work, you can't be working 50 hours a week, you can only work 3 days a week, then your employer would have to consider, in order to keep you at work and to keep you working, whether that would be a reasonable adjustment compared to someone else that didn't have your problem, as an example. This is a very grey area and completely open to interpretation. at the end of the day, the one opinion that does matter is a judge in court, and that's if it went that far. But just so that you're kind of aware of what that entails. And just finally, good medical practice. Just to remind you that GMC do say that it's really important that you seek help if you are concerned about a health condition that might have an impact on your ability to work, and don't self-treat or self-manage or self-assess. Go and get some help as soon as possible, and that is relevant to all health conditions. So let's go back to our Q&A.
I've been beavering away typing answers to some of the questions, so you may want to go back to some of those to share with the group.
Yeah, I mean, so what have you been answering? What have you been doing?
So I've just been typing away some responses.
Section. There's 16 in the section and 3 open, but obviously there's some.
Yeah, so it'd be really useful if you could share some of these with the listeners.
With the listeners, yeah, sure.
Yeah,
so there was one person that asked me about they've been struggling with depression for a long time, but really finding it hard to communicate to their loved ones what's going on for them, and really identified with that idea that as doctors we tend to put on a brave face, and often people don't know just how bad things are for us. And one of my suggestions was that it can be really helpful to talk this stuff through with someone. So if they haven't already, to either see their GP or to go to something like the practitioner health program and have some time just to talk through and think about how you might approach talking to loved ones, because it is hard. It is hard to be vulnerable and to open up and to show how much we're struggling. I think we all want to, I certainly would rather put on a front that I'm okay all the time. I was sharing just before we started this webinar that, today I had a tough day. Actually, I didn't feel great. I had, I just felt a bit blah, a bit headachy, didn't have the motivation, a little bit down, nothing major, but just not great. And it can be really hard to show that and to and be honest. It's so easy, isn't it, when someone says, how are you, or how was your day, to just say, yeah, fine, thanks. And it took me a long while to learn how to open up and to talk more honestly about how I was feeling with my loved ones. And I did that with support. So I would say, get some help, get some support, and practice. Start with somebody you really trust, that you feel you could open up a little bit to, and just give it a go. Just try telling them one thing that you're feeling or thinking, and see what happens, and just gradually build up and do that more and more. And in the end, it becomes easier and easier, and you can do it on a live webinar to dozens of strangers without difficulty.
Cool. So just looking at some of the questions, one is actually commenting on a previous question. I'm not really sure, I can't remember what that was now, but someone said in response to someone else who posted, I don't really know, but try different medications. There's genetic variations that cause variability in response to SSRIs. So it might take trying up to 3 or 4 SSRIs before finding the right one. I think it's important for you to find the right counsellor or therapist. Again, there's lots of counsellors and therapists out there, so it's really important that you have chemistry with them. So feel free to shop around, so to speak. But I know, obviously, if you're unwell, it can be quite difficult practically to do that. And there are organisations that will offer low-cost therapy. And someone also said, if you haven't already talked to your employers, for example, less than full-time working might help ease the pressure. Yes, that's true, even temporarily, or for the foreseeable future, take it step by step. So yes, it doesn't have to be permanent. So someone else said, just say thank you for going on to the physical health comment above. I think it's amazing that mental health is being brought to the forefront, increasing support is available. Brilliant. So someone else said, along with the rheumatological issue, I think someone's actually commenting on the issue. Could I ask what reasonable adjustments you've been trying to request? I'm really sorry you've been having problems with certain rotations suit you better than others. Would the foundation score be more helpful? And we also had another question in the chat. Again, another ARCP concern coming up, and the dean is asking for a letter. It feels like they're starting the process of kicking you out due to failure to progress. due to multiple sick leave and extensions to your training. You're dreaming this up is a possible reality. I know this is it's always a very emotional issue, especially if you're unwell, from both sides, really. I think it's really important to remember that people that are on RC panels, they are human beings. They're not all evil or dragons, but at the same time, they do have responsibility to ensure that trainees are progressing. I mean, that's what they're there for, essentially. So getting an OH review is a very important part of that process. It doesn't mean they're actively trying to kick you out. I know it definitely would feel like that, and that's a very normal feeling, but that might not be the situation. But if you have any queries about that, I don't think there's any harm to actually just have an open conversation with your training program director about how you're feeling, about what your possible prospects are staying on the program, considering what your health condition is, and to try and identify other ways of really kind of getting to the goal. I think it all depends on what your goalposts are, and I actually had a bit of a kind of rant on the less than full-time training program forum in Facebook recently, simply because I've come to the realization, actually going through my own journey, that less than full-time training can be very difficult. And obviously there are lots of reasons why people go into that, because of family, caring commitments, career issues, health problems. But it's very difficult to finish a training program because it's extended so long, and you're still training, and the responsibility is still there, but in a shorter period of time in the week. So it can be really challenging. But there are other ways to finish your training, and it might be worth also exploring the non-training route, which is the CESAR route in the UK, CESR route. That might be a better option for you in the longer term, depending on how you feel. But there are so many different options, but it's also about just making sure you explore all of them and make a decision for you as to where you want to really be going with your career, and focus on that. And I'm sure you'll get there regardless. But again, most important thing is to get better.
Yeah, sorry, go on, Ali.
I think collaborating with occupational health, like I was involved in occupational health at Bournemouth Hospital when I was ill, and they were so great. Like, they were really, really good. And obviously it sounds like you are in occupational health on the radar, but they included me. They actually wrote a letter with me sitting beside them, and we wrote it together. So that if there's an option to do that and actually arrange an appointment with occupational health to collaborate on a letter that you both feel comfortable with, then you have every right to do that as well.
Yeah, and I would just add, agree absolutely with everything that Abeyna and Ali have just shared. And I can really relate to that feeling of fear, actually, that somehow people are out to get you or to throw you off the training program, or they see you somehow as a trainee, problem trainee. And it can be very hard to kind of step out from that slightly sort of almost paranoid viewpoint and to just realize the reality, which is, when you're a trainee, everybody sitting on that panel desperately wants to help you to finish your training. That's why they're there. It is their job. They want to support you, they want to help you. And actually, once I started to kind of get my head around that and realize that people were actually on my side, that helped me relax a lot, and that kind of just helped the process go a lot more smoothly and to feel a bit nicer. And everybody wants you to finish your training if you want to. And having multiple sick leaves is no problem at all. It doesn't matter. There is no ticking clock in the background. It is okay that it takes a long time. People have prolonged trainings for many, many, many reasons. My training is still going on. I've stepped out with 1 year to go, but I've been training since, for well over 10 years. It's absolutely fine. And but I can identify with that sense of thinking people are going to try and kick you out, but they're not.
Mm-hmm. Well, they're not actively trying to do that, but obviously there's no guarantees. It really depends on the specialty and what's going on in health education in England. So unless there's any more questions, just to mention, we do have our second annual Dr. Rose Poll's Wellbeing Award this year. And so this is an award which is dedicated to Rose, as mentioned earlier on in the presentation. Last year, Tea and Empathy Facebook group were the winners, the first ever winners of this award. And we had so many amazing nominees that we have actually mentioned on our conference page from last year. That's acw.medicfootprints.org. But if you would like to nominate someone again this year, it can still be Tea and Empathy if you want, it could be anyone else, an individual or institution. Please go to the dcwonline.org website and go to the awards section. And then finally, we've got some more webinars happening next week. So both these are available if you are a member of Medic Footprints, which is only £6 a month, and is we can cancel it at any time. So we've got, if you're looking to go into something non-medical or something that's non-typically medical, then you need to shorten your CV drastically and change it to really focus on those transferable skills and your unique selling points. Then we've got a CV masterclass with our organisational growth lead Owen Bubbers, who used to work for Hayes Recruiter, and Sarah Sabin, who is our co-founder and also has done probably transformed thousands of medical CVs into beautiful non-medical ones, particularly within management consultancy. And then on Thursday, we've got some information. We've got a lovely webinar about applying and working in the UAE. And so just to go back to some really important take-homes, listen to yourself. So listen to your body and mind. Do not ignore it, because it will come back and bite you even harder and even bigger at someone in the future. And I'm talking from a very personal perspective. So if you feel like you can't cope, is a very normal feeling, especially if you feel like you're a failure, if you failed in work. And that doesn't actually mean that you are a failure. It doesn't mean that you're not capable of doing something. It just means that you're not well, or you're not as great as you could be, and that you just need a bit of time and some help. Don't keep quiet about it. Go and get some support. Not all difficult emotions are irrational. So Caroline spoke earlier about having suicidal thoughts. It doesn't necessarily mean that you're going to act upon it, or you're wanting to act upon it, or that it's an irrational feeling. But again, it's really important that you find the right support to kind of speak about that. Get some help from supportive sources. So if you find someone that is not supportive, move on and find someone that is. So that can be from various sources. As mentioned, your employers are legally responsible for your work. So if your health and safety. So if you are worried that actually you're being overworked and your employer isn't supporting you, just remember that it is their job to look after you whilst you're at work, and kind of enter some really useful negotiating conversations. And if they're not supporting you at work, you are well within your rights to complain about that to various bodies, or not go to work if you feel that it's not safe for you to do so. Obviously, there's lots of medical legal consequences to that, and you need to be speaking to the right people about what's best for you. And you are responsible to ensure that you are fit enough to work, as we mentioned, from a regulatory perspective. But also, the onus is on you to speak up if you don't feel like you're well enough to go to work, and if you don't know, kind of seek medical advice. So I think that is the end of our presentation. Caroline seems to have basically sorted out about 50 questions. Sorry. So actually, we've come to a kind of very nice end just before 8:18. So just want to really thank you, our panelists today, for taking the time to really share your own personal stories, and also give us some really important insights into what's happening with doctors' mental health in particular, and how to support each other and ourselves in a kind of well-being and health scenario. As I said, we are running this amazing virtual online conference similar to this, but all day from 8 till 5 on the 13th of October. So that's dcwonline.org. So if you're watching this and you have registered for this event, you will get more information about that. And also to mention that Medic Footprints will need your help because we are building a platform. Part of the function of that platform is to ensure that all doctors get the best and the right career coaching for them, and also to connect them with wellbeing support and diverse career opportunities, just so they can have choice. So if you want to find out more about that, again, just follow us on medicfootprints.org on our subscriber base, or come to the conference and you'll find out more. So yeah, with Ali, you can find her on the blog and noggin. She's typed out.
Yeah.
And this recording will be available as well to watch. And if you have any questions in the meantime, feel free to address it to anyone. So thank you. Thanks, guys.
Thank you so much, Abeyna.
Thank you.
Just left my email in the chat section in case anyone wants to get in touch.
Caroline.walker13@nhs.net for those of you that can't see the chat from the recording.
Yeah, if anyone wants to get in touch, any questions or concerns or anything like that, please do.
Yeah, so yeah, brilliant. I hope everyone has a great evening, and I hope you found this webinar useful. And thanks again.
Thank you.
All right then.
Bye.
Take care. Bye. Bye.